Earlobe repair surgery is one of the best options to treat torn earlobes or stretched out earlobes. So, if you're considering it for yourself, here are some questions that you might want to ask going forward. Hi, I'm Dr. Jordan Carqueville. I'm a Mohs surgeon and cosmetic dermatologist. And if you're new to us today, feel free to subscribe and pop in any questions below. And let's get into it today. The first question is, am I a good candidate for this surgery? So the best candidates for an earlobe repair might be someone who has a fully torn earlobe. So the earring gets just yanked out and you have two little flaps of earlobe. Can't really wear an earring there. The other candidate is a stretched out earlobe. So after years of wearing heavy earrings, it creates a very long, um, elongated earring hole. And sometimes we do earlobe repairs for patients who have keloids. So we also remove keloids and then repair the ear that way. So if you have any of these, there's a good chance that you would be a candidate for this surgery. The next question is what to expect in an earlobe repair. So when we have a patient come in for an earlobe repair, I have the patient come in and we evaluate the site. We clean the area off, we mark where we want the next piercing to be, and we plan the reconstruction. So we'll clean off the ear, start injecting some numbing, we'll do our planning, and then the procedure begins. It's painless, it's fairly quick, maybe takes about 30 minutes, and some stitches are put in afterwards. The stitches will come out in about a week, and actually at the time of surgery, I usually do re-pierce the ear. The next question is, what is the recovery timeline? So with any surgery, we want our patients to take it easy for about a week. The sutures, the stitches that are holding the repaired earlobe together will stay in for about 6 or 7 days. So when I perform a surgery, we usually will give you a follow-up appointment in about a week. So just be careful not to get, play contact sports or tear that delicate skin that we just put together. But it's about a week recovery. The first day after the surgery, someone might feel a little bit of soreness. That could be 1 or 2 days. That's pretty common for any surgery. So you can take Tylenol, something very easy to just calm down any discomfort. Often I do re-pierce the ear on the day of surgery, so I'll have you cleaning that little earring area with warm soapy water or a solution, and then putting Vaseline and twisting the earring. But it's pretty minimal with pain. So one additional note I want to make about the surgery is that sometimes we have real thin, paper thin lobes, almost like I call them pancake lobes. That's usually when patients are a little bit older. And about 6 weeks after the procedure, I'll often inject a little bit of a hyaluronic acid filler, and that's going to really help give life to that earlobe. And it makes the earrings look better when like a little stud look a little bit more supported in that lobe. So you can always ask me about that too. So if you're considering the surgery or have a torn lobe or stretched lobe, it's a really accessible procedure and quick recovery. Most of my patients are so happy that they did it. So feel free to give us a call and we can talk about it.